Good afternoon, everyone, and thank you for joining us for today's presentation. My name is Chelsea Benedict, and I'm the Director of Development for the OHSU Foundation. Today, we will be hearing from Dr. Kent Thornburg on the power of nutrition. Dr. Thornburg is the Director of the OHSU Center for Developmental Health at the Knight Cardiovascular Institute and the Director of OHSU's Bob and Charlie Moore Institute for Nutrition and Wellness, an international leader in translating the science of developmental origins of health and disease. But before we get into the conversation, I want to share with you some housekeeping items and how you can engage with us during the presentation. We will be using the chat function, which can be found to the right of your viewing screen. In order to participate in the chat, you can log in via your Vimeo or Facebook account, or participate as a chat box guest by selecting the Chat as a Guest blue link. If you need assistance at any time during the presentation, please feel free to email fdnevents@ohsu.edu, and our team is going to copy and paste that email address into the chat box now for your reference. With that, it is my great privilege to begin today's conversation with Dr. Thornburg. Dr. Thornburg, how are you this afternoon?
Hi, Chelsea. I'm doing well, thanks.
Great. Well, I'm super excited to share more about your work with the over 200 participants we have viewing today. Hi, Mom. If you could kick us off, Dr. Thornburg, by telling us a little bit more about yourself and your role at OHSU.
Sure, I'd be pleased to. I've been at OHSU for several decades, and during that time, I've really enjoyed the opportunity to be at such a wonderful institution. I'm a professor in the Department of Medicine. I'm in the Knight Cardiovascular Institute, where I spend part of my time with the Center for Developmental Health. And in addition to that, my real efforts are with the Bob and Charlie Moore Institute for Nutrition and Wellness. It's really a privilege of mine to be a participant in this, and I have several people to thank for the success of this organization. These include Bob and Charlie Moore themselves, who have made it possible for this institute to exist, and also several foundations and funds that have really helped us on specific projects that we're interested in. And lastly, I have to give special thanks to the National Institutes of Health. They have supported our projects over the decades. They continue to involve themselves with what we're trying to do, and we're very thankful for their support. I also have to thank people that have helped me along the way. If you look at the middle of this slide, you'll see a long row of young people. These people have trained or are training with me in my laboratory, and they have brought so much excitement to the work that we do. Also, I want to point out that in the upper left corner, you'll see Joanne Rogovoy for the March of Dimes. She's a dear friend and has been a helper for the Moore Institute kinds of activities over the decades. And in the lower left, you'll see Izzy Ventura Mida. He's from Familias en Acción, and we're really pleased that we are able to work with Hispanic groups, and especially about the health of Latino women. So we're very interested in helping different communities in Oregon. The first topic that I want to bring up is a statement that the health of the Americans has been worsening for 3 generations. And we know that this is true. Most people haven't noticed it, although they may have heard that people are getting heavier, there's more diabetes. But now we're at a catastrophic crossroads in this country for our health, not only because of COVID-19, but also because of this epidemic that I'm going to describe to you here in a minute. So the chronic disease epidemic is the one that now we at OHSU are going to tackle, and I hope that you'll understand why it's so important to us and that maybe you can help us. I'm going to start by talking about the rise in obesity that has occurred, and it turns out that if you look at a graph of what's happened to men's weight and women's weight, you'll notice that over the last 20 to 30 years, it's been increasing on the average. So in this slide, you'll see that the percentage of the population of men who are obese started at about 10% in 1960, and rose to about 38 to 40% by 2014. The same for women. They started at about 15%, and by 2014, they had crossed the 40% line. This is an example of the decreasing health of Americans. This slide shows the number of people that are diagnosed with diabetes. These are CDC data, and you can see that they've been increasing since 1980. And by the way, the records go back to 1958, and I'm probably one of the few viewers that can remember that year. But it turns out that even in 1958, we hardly knew anybody who had diabetes, and now we can see that the rates went up from 1980 to the mid-90s. And you'll also see that starting in the 90s, it went up much steeper, so that now there are some 20, 30 million people in this country that are known to be diabetic. And the American Diabetes Association says that some 13% of our population now is in that category. Now, we worry not only because this causes people to suffer, but we're also worried because diabetes is a major cause of heart disease, and heart disease is an expensive disease that requires a lot of care that goes beyond people who have diabetes. So the CDC now has agreed with us that we're in an epidemic of chronic disease, and they say now that 6 in 10 adults have at least one chronic disease, and 4 in 10 adults have more than one. And this is a big problem because as the population ages, more and more people are in this category. And you can see along the bottom of this slide what we mean by chronic diseases. You can see heart disease, cancer, lung disease, and stroke are the big ones, and those are the most expensive. And as we get older as a society, and as people get heavier and heavier, the burden of disease is increasing ever more. So if you see in the middle of this slide, CDC says that the total cost for caring for these diseases now is over $3 trillion. And I'm going to point out to you that this is going to increase in the future. First, let me say something about how this is happening in Oregon. If you look at the upper left corner, you'll see that the percentage of the Oregon population that's obese has been going up from about 12% to over 30% between 1990 and 2015. And you'll also see that in diabetes, it went from 4% to over 12% during that same period of time. So it more than doubled in obesity and more than tripled for diabetes. And if you look at the lower right of the slide, you'll also see that the importance of this is in the number of people who will be getting heart disease. Heart disease back in 2010 was almost 250,000 people, but the Oregon Health Authority suggests that this could be over 1 million in the next decade or so. And that is a very expensive proposition for Oregon to face. Now, I've included a map of Oregon with all of its counties in the upper right-hand corner, and you'll see in that corner 2 counties, Jefferson County and Deschutes County, that are 2 counties that I want to pay attention to in terms of their burden for disease and these chronic diseases in particular. The projected costs for cardiovascular disease through 2035 is that right now it's about $500 million a year, $500 billion a year, and we're expecting that to double to 1.1 trillion by 2035. And this increase is really frightening because, just to be honest with you, I don't believe that we can double our insurance rates in that period of time. And I'm also worried about the fact that this cost will mean that we will have to be triaging people on what we can do for them because we cannot afford to do more. So this makes this problem that I'm talking about today extremely urgent. First, because so many people are suffering, and secondly, because this will lead to a cost that I don't think our society will be able to sustain. So we have to ask the question, why are chronic diseases rising? And that's where our science comes in, we've made astounding discoveries over the last 25 years that explain why these chronic diseases are rising. And this comes about from work by David Berker. I showed you his picture in the upper left corner just so you'll know it's a real person. And David Berker was a famous epidemiologist in England. He came to the US to work with us in about 2003, and he worked with us until 2013 when he died. And what he showed was, in this graph, what he showed was that a person's risk of dying of heart disease, if they're in the 5 or 6 pound range, is 3 to 5 times higher than if they're born down at the bottom of this curve in the 8 to 9 pound range. He also showed that that risk goes right back up as babies are born at heavier weights. Now, it doesn't mean that all babies born either low or high will have heart disease, but it does mean that they will have a much increased risk for heart disease because of the way they grew before they were born. And they grew differently for 2 reasons. One is they have compromised organs. And that's because if during the growth process a baby has too little nutrition, for example, they will take shortcuts on the way they make their organs, especially the heart and the pancreas and the kidney. And likewise, if a baby has too much what we call overnutrition and large amounts of fat that come across the placenta, they will store that as fat and compromise their organs, and they'll be more likely to have disease later in life. So both of these ends of the curve are important for us to understand as drivers for disease, because what we've discovered is that these compromises lead to all the chronic diseases that we're used to thinking about. These include type 2 diabetes, heart disease, hypertension, obesity, lung disease, and many more. Now, what we discovered with the advent of COVID-19 was that the CDC was noticing in hospitals that the people who had the most severe cases and also the most cases of mortality were people who had underlying conditions. And what we've discovered, as shown in this slide, is that all of those underlying conditions, except one genetic condition of sickle cell anemia, are caused by poor growth before birth. And that poor growth, which starts in preconception, during pregnancy, and during lactation in particular, during those periods of time, if a baby or a developing person does not get enough nutrients during that time, they're at high risk for all of these underlying conditions. So now we know that in our future, in order to prevent people from having underlying conditions that make them vulnerable for chronic diseases, we have to do something about this problem. And this is especially acute in specific race and ethnic groups. And this comes from the CDC to show you that in COVID-19 cases, those cases where there's more hospitalization or death, more cases occur in Native Americans, in Native Alaskans, African Americans, and Hispanic groups. So the number of cases are about 3 times higher in those groups, about 5 times higher in terms of hospitalization, and even 2 times higher in African Americans in death for people who acquire this disease. So now we know that the social circumstances in which people grow and live in their early life makes them vulnerable for these diseases, and this is especially acute in these particular groups of people that we care so much about. And we've learned from the science that diet is really an important feature of this condition. And this is a very interesting slide because it shows from how the American Heart Association has tracked the factors that are likely to lead to heart disease. There are 7 of these pillars, and what they've shown is that in addition to smoking and obesity and physical activity, cholesterol and blood pressure and fasting glucose, that a person's diet is really important as a risk factor for getting heart disease. Now, what's interesting about this is that one of the lowest now in terms of our society of people having high risk is found in the smoking group. Even more than this, since this slide was made, we now know that about 17% of Americans smoke, and we're feeling really good that the number of non-smokers is increasing, and this has dramatically reduced people's risk for heart disease. But look at the middle bar. You'll see under diet that the American Heart Association says that over 2/3 of our society are malnourished, they eat poor diets, and they have very high risk for cardiovascular disease because of that. And only about 1/3 of those are eating a halfway decent diet. And if you look at the very top, I've made a circle around it, you'll see that less than 1%, about 0.5% of Americans, according to Healthy Eating Index survey, eat a healthy diet. And that includes all men and women. That includes people who are reproductive age and not. And this reproduction piece of it is really important, so I want to say more about it. A lot of people ask, well, what is a balanced diet? What's a good diet? And it's a very simple proposition. It turns out that if you eat these foods that I've listed there on the left every day, you will eat a healthy, balanced diet. And these include whole grains, these include fruits and vegetables, these include nuts and legumes, and I've also added fish. Now, I always make the point that I'm not trying to tell you to eat your goldfish. I'm pointing out that fish is an important supplement for people who are not vegetarian to find omega-3 fatty acids, and this is particularly important for women who are pregnant, but everybody should eat fish if they can in their diets because it reduces their risks by the free fatty acids that they eat. And lastly, let me point out that olive oil is really important too because this has been found in the Mediterranean diet to be highly protective of cardiovascular disease. So you can see from this diet that you get everything you need: vitamins, minerals, fatty acids, antioxidants, and amino acids, and you get all kinds of health-promoting nutrients, some of which we probably don't even know about, and they release their glucose slowly so that you don't get glucose or sugar surges in your blood. And you can eat a healthy diet by avoiding the things that cause harm, including refined grains like in white bread, refined sugar and saturated fats and high salt. All of these in the diet cause harm and lead to chronic disease over your lifetime. Now here's an example of a way to take this information, and you take this plate and you eat something out of each quadrant of this plate during each meal, and you will eat a healthy diet. This was made for pregnancy. You can download it from the Moore Institute website, and we have it in Spanish and Russian, and if you have friends or colleagues or people you work with in those languages, you can pass this on to them. I should tell you that neither my wife nor I are pregnant, but we still take advantage of this plate because it's good for everybody. It's not just for pregnant women. It does help women in pregnancy make sure they eat a balanced diet for their babies, but it's also good for everybody. And if you're embarrassed by that and you're not pregnant, you can cut that off. So I'm just recommending that you try it. So we now know that the nutrition issue is so important that it's taken a stage on the whole worldwide. So we have not only a COVID-19 pandemic, but we have a pandemic of poor nutrition. And this poor nutrition has really come to a head from this article published in the English Lancet in 2019, which showed that in 195 countries, 11 million deaths could be attributed to poor nutrition. 3 million people from too low of an intake of whole grains because they don't have access to it, too high intake of salt, or too low intake of fruits and vegetables. This now tells us that this is not just a national problem for us, but this is an international problem that we should be paying attention to. And I already mentioned how important the National Institutes of Health has been in this, and I just want to hand it to them for the amazing work they're doing in this area. And what we found out when this came out in 2020 was the strategic plan for for Nutrition Research at NIH includes in their top 4 priorities the developmental origins of health and disease. That's the name of the science behind how early development leads to adult disease later in life. And so they're suggesting that we need to study mothers and fathers, pregnancy, and lifestyle changes over the course of a person's life until they become adults. They also suggest that we study the microbiome, those intestinal bacteria that are now known to influence strongly how much weight we put on and how our metabolism works. So we're very excited about this, and I want you to know that we're proud at OHSU for having influence on this coming about by the work that we've been doing with NIH. So now I want to say something about epigenetics, because a lot of people know about the word, but they don't really understand it. I can give you a very small little lesson on epigenetics. If you look in the upper left corner, you'll see 2 young women. And what's interesting about these women is they are genetically identical. They're identical twins. But they have different fingerprints. And the reason their fingerprints are different is because their nutrition was different, because they shared a placenta, and one part of the placenta that supplied nutrients to one was different than the part of the placenta that supplied nutrients to the other. So because of that, their fingerprints, which depends on nutrition in weeks 13 to 15 of gestation, were different. So now their fingerprints are different because their nutrition was different. And that's an epigenetic effect. Their genes are not different, but their genes have been affected by nutrition. If you look at the mice in the lower left corner, these 2 mice are genetically identical, but they have a gene that's very sensitive to nutrition. And you can see that the yellow fat mouse on the left is more sickly and will live a shorter life than the brown mouse, because the mother of that mouse did not get good nutrition, but the mother of the brown mouse did. And therefore we can see by studying these mice and show that they are epigenetically different, and that's the reason you see these differences. Now I can point out about a little bit to you. There's a lot of science behind this, but I can give you a tidbit on how this works. If you look at this strand of DNA in this beautiful picture, you can see that there are 2 bright spots. And those bright spots on that DNA represent the chemical change that can occur to DNA to silence genes, or like a rheostat, to turn down how much they are actually active. And it turns out that diet and stress in a mother will change certain genes in the developing embryo and fetus, so that those genes will behave differently later in life than they would have otherwise. And it turns out that all of us can change the methylation pattern that's regulating our epigenetics of our genes at all times during our life, but it's most sensitive during our developmental patterns, and it's that period of time that's most likely to make a difference on whether we're likely to have disease later in life or not. So when we're adults, especially by the time you get to be my age, I'll tell you that we all carry an epigenetic burden that goes beyond our normal epigenetics based on our lifestyle and those epigenetic changes that occurred to us when we were in the womb and before. So our epigenetics of our grandparents, of our mother and father, of our mother's stress level while we were in the womb, and her nutrition, the nutrition we got in infancy and childhood, and also childhood adverse experiences are powerful ways to change the epigenetic burden that people bear. And there's a very exciting science, which I'm not going to tell you the details about, but just to whet your appetite, there's new epigenetic research now that shows that we all have what's called an epigenetic age. And that's the age at which our bodies are aging based on our epigenetic that's separate from our chronological age. So in one sense, we're aging both biologically and chronologically at different rates. And it turns out that this epigenetic burden that we bear is now something that we're doing hot research on to try to figure out how we can make it better. So I can point out that this early life effect really matters at all stages before reproduction. You can see that in the left-hand part of this slide, you can see the female reproductive tract, and you can all remember your biology that every month during reproductive years, an ovary releases an egg into the oviduct. If there's sperm there, it will be fertilized, and that embryo will start to develop as it travels down the oviduct over the next week or so before it lands in the womb to implant to cause a pregnancy. Now, during that journey, that embryo is already reading the mother's nutrition. It's reading amino acids and sugars and fats in the blood, and it makes biological decisions such that if the nutrition levels are low for that embryo, then it will already change the way it's going to grow so that the placenta will become bigger. And you would expect that if an embryo thinks it needs a bigger placenta to get nutrition. And that large placenta is a key indicator of whether the baby will likely have hypertension and have an effect during its later life. In the middle curve, you'll show the beautiful picture of the woman who is pregnant with her son, and you can see that her nutrition not only affects her baby that's growing in her womb, but it also will influence her child, and her child will need to eat good nutrition, or even at that age, in order to be a healthy person when they get older. And lastly, let me say that in the first 2 years of life during infancy, nutrition is really important. Lactation is very important during this period of time because breast milk offers so much advantage to a child to prevent heart disease. But also the fact that babies can now be weaned onto healthy foods and brought up in a way that they have a taste for good foods is now really one of the things we're realizing about how to build healthy people from scratch. Now I want you to see this picture. It's one of my favorites. It comes from the NIH archives, and it's 4 generations of women that were taken in 1931. I want to focus on the 2-year-old baby that's in the mother's arms. I like the hairdos in 1931. I just wanted to point that out too. The important part is that this baby is now in her 90s, and the egg that made this woman who's now in her 90s was made when she was a fetus in her mother's womb, the mother holding the baby. So when she was a fetus, the mother's ovary made the egg that would make this woman, and that ovary was nourished by her mother, who is the mother over in the left, the woman born in 1879 about. So it turns out that the nutrition of a woman today, a 90-year-old woman, was influenced by what a woman ate in 1879. This is across 2 generations, and we call this nutritional flow across generations. And the egg that made the 27-year-old mother came from the nutrition of the woman who's sitting down there who was born before the Civil War. We call this the 100-year effect, and I'm the best example for it because I'm in my mid-70s, my mother is in her late 90s, and the egg that made me and my risk that comes from epigenetics of her diet were determined almost exactly 100 years ago. So this 100-year effect happens in everybody. Every young boy and girl who are now growing up and will become reproductive, the way they build their bodies now will make a difference in the future 100 years from now. I have to add another feature to the diet question, and that has to do with what we call allostatic load. An allostatic load is the changes in the body that occur because of toxic social stress. And I'm talking now about during pregnancy. So you can see that there are a list of things that are really important that cause toxic stress in women who are pregnant. This includes racism, housing, physical abuse, fear of safety, and poverty. These things change a woman's hormonal balance for stress hormones that change the placenta and lead to offspring having a different epigenetic profile. Now, the big worry is you'll see that there are two overlapping circles. There are women who live in the overlapping area of these circles that have both nutritional stress and social stress, and because of that, they have a double whammy for their kids that change the epigenetic load for the child and change the way they grow in the womb. They grow more slowly, they're smaller when they're born, and they have high rates of adult onset disease risk, we now know. So we have to have some hope for this, and I wouldn't be in this business if there were nothing we could do. But the truth is we can do things for current generations as well as for future generations. And David Berker, that I introduced to you earlier, wrote a really important paper that should be highlighted by everyone. And that is that even though diabetes has been going straight up since the mid-90s, he made the point that based on the epigenetics and the epidemiology, we would be able to reduce the rates of diabetes in our society, and therefore heart disease, by 57% if we had two conditions. One, if we could help babies born in the normal birth weight in the 7 to 8 pound range. And secondly, if we could prevent children, like the child on the right that you're looking at, from becoming fat before the age of 8 years old. Children who put on fat early are more likely to become diabetic and have heart disease. And this says all kinds of things about social stress, especially now that we're thinking about COVID-19. What about children not getting their exercise because they're in the house on the screen? What about children who don't have enough access to food because their parents have lost their jobs and they are food insecure and they're outright just hungry? These are social problems that we're facing here in Oregon, and we in the Moore Institute are very interested in these questions. So how do we reverse this? This is the question we're asking all the time. We've concluded that a strategy to do something about this requires every community taking it upon themselves to find out how their community can tackle this problem best. So our strategy is to get communities behind an effort that they lead that will change the way in which the health is dealt with in their society. And this means support from leaders. It means support for young children even before they think about pregnancy. It means nutritional support for women just before they get pregnancy, during their lactation, and during their early feeding of their children. And the last thing is that we need community projects that really highlight to everybody in the community how important their future health is, how every individual matters. And we're very interested in seeing whether that can be done across the state of Oregon. So we're starting the OHSU Moore Institute Nutrition Campaign. We've just completed phase 1. And now we want to start phase 2, and I want to tell you a little bit about that. We have our guiding principles, and this principle is one we believe that is absolutely certain, and that is that we cannot decrease the rates of chronic disease without changing the diet and stress of mothers during their pregnancy, both before they become pregnant and early after. This will not be possible. So we have to improve these nutrition levels at all these ages in every ethnic group that are a part of our communities. And secondly, we require this to be driven by communities, not by us. We don't go to any community and tell them what to do. We show them the science. We tell them what the problem is. And we ask them, what is it we can do together? And lastly, we want you to know that OHSU is taking science and we're translating it into real-life changes that will impact communities across the state of Oregon. So I wanted to show you this slide about what we've done in phase 1. In phase 1, we've made connections in many counties across the state. All the yellow stars we see are hubs, and these are hubs that we work with a memo of understanding about how we're going to work together and raise money together to improve the health in their communities. And we have several others online that we want to bring on board, and we need to raise money to make that possible. And secondly, all those sun stars you see across Eastern Oregon are counties that belong to the Eastern Oregon Healthy Living Alliance. This alliance is a health alliance that has their own CCO, and they are really hell-bent to do something about the health issues that they're facing. And we are very interested in working with them to have an impact across all these counties. So this is an exciting opportunity for everybody in Oregon to get together to do something to make Oregon the example of a state that can be the healthiest of all. Now, how can we do this? Well, everything we want to do costs money, and we are seeking partners to help us end this chronic disease epidemic in Oregon. And there's many things that people can do. The first thing we would like to do is to have a trial where we can go to communities and try different diet trials to see how the biology works among women and men in those counties, to find out how diets affect their placentas, how it affects their blood and the blood lipids, and the outcomes of their babies. This is expensive. Eventually, we want the National Institutes of Health to support this, but in the meantime, we need to do a trial study to show that this is feasible and that we can do it. And secondly, we want to kick off phase 2. And to do that, we want to have new county hubs that cost about $50,000 a piece. We want 4 of those. We want to offer support through Familias en Acción for Latina women to ensure that they have access to healthy food, because they have a particular problem of having chronic disease going up faster than for the rest of us. And we want to bring our scientists to healthcare providers across the state of Oregon. Most doctors, nurses, and practitioners don't know anything about the science that I've talked to you about today. We want to make videos, make those available, and give them their advanced credit for their licensing to learn about a new field of science that will impact the way they treat their patients and they advise their patients. And also, we want to impact kids in the schools. We have a Nutrition in a Box program. We're very proud of this. And just to give you a hint about how this works, these cost $500 a piece, and we'd like to see these in every middle school in Oregon. And what we do is we put together a box, and the students can open the box, they can pull out hands-on exercises, they can hold up and see how much sugar is in a bottle of Coca-Cola. They can learn all about nutrition and how to eat a nutritious life. They're really amazing and impactful. We've had these evaluated by the SNAP Ed program, and now we're ready to send these out to all the schools of Oregon. And if anybody is interested in helping us do that, we'd be appreciative. Now, I'm not going to say any more. I know there are people who might have questions, and I think, Chelsea, you might want to moderate that.
Thank you, Dr. Thornburg. As a very food-driven person myself, I found this presentation incredibly interesting and digestible. With that, I'd like to open up our Q&A portion of this live virtual event. As a reminder, you can engage with us via the chat box feature on the right-hand side of the screen. Our chat box moderators are standing by to help. We received multiple questions from our viewers during the registration process, so we're going to go ahead and start with one of those. You touched on this a little bit in your presentation, Dr. Thornburg, but can you elaborate on the role nutrition plays in COVID-19 and our ability to overcome this and future pandemics?
Thank you. I wish I had a magic answer on how nutrition could prevent us from getting COVID right now. But the truth is, we can help people prevent diseases like COVID-19 in the future by having people that are healthy without underlying conditions. we have to do this because we have heard even from Dr. Fauci say nationally that this is a tragedy in the number of people who are vulnerable for this disease. This doesn't have to happen. This can be changed by improving the health of people across this nation, and we're interested in doing that in Oregon. And secondly, let me say that now we need to provide good nutrition for our children. I've already mentioned that there are a lot of food insecure people in this state that don't know where their next meal is coming from. We need to pay a lot of attention to them, and especially to children that are going hungry. So I think that we can do a lot right now by providing good nutrition and low stress environments for people who have lost their jobs and who now need our help. So I'm optimistic that we'll do a lot better when we have the next pandemic.
Well, that's great to hear. What will the long-term impacts be from social issues such as food insecurity and economic uncertainty from the COVID-19 pandemic?
Yes, that question follows on beautifully, and thank you whoever wrote that question, because we've learned from the Dutch hunger winter that happened in World War II that people who were deprived of food during that time and women who were pregnant, their offspring suffers more of the same conditions that we call underlying conditions now, and many of them have heart disease, diabetes, and lung disease, and dementias because they had poor growth before they were born in the womb. So as I've just said a moment ago, we have to be really vigilant in finding out who those people are in our society and our communities who are food insecure, who are going hungry, and for pregnant women and women about to become pregnant, we have a dramatic and urgent need to do something for them.
Thank you, Dr. Thornburg. I love our next question. Our viewer writes, I know the importance of a woman's nutrition to the health of her future children and grandchildren. Does the same go for a man's nutrition? My young sons are eating mac and cheese or ramen almost daily during the pandemic. Are their grandchildren doomed to a life of chronic disease?
That's a great question. I will say, first of all, that your young men are eating the same diets that everybody that age eats, and I hope we can change that trend. But they're not doomed, because there's reversal of epigenetics that is possible because of improving diets. That's been shown and it's especially valuable in young people. As we get older, we become more hardened physiologically, and it's harder to change our epigenetic profile. But when you're young is a good time to start eating healthy diets and make a big difference. Secondly, I just want people to know that men's diets during their reproductive years are also important, because sperm are modified by diet just like our eggs, and those sperm can be modified and passed on to the next generation and their offspring just the same way eggs can be. So young men need to have good diets as well. Mothers are different than men because most men don't carry a baby. That's left to the women. And women who have babies in their womb provide nutrition that goes beyond that epigenetic effect that was found in the egg. So I think that answers that question. Thank you.
Great, thank you. Can you tell us a little bit about what opportunities there are to volunteer, especially for physicians in the community, to support the Nutrition Oregon campaign?
Thank you. We would love to have physicians on board with us to give us ideas about how we can spread this message. Like I said, we're looking for support so that we can make videos, a series of those that physicians and other healthcare providers can take to get credit for them. What I am really interested in is hearing from physicians about a discussion on how they can talk to their patients and make an impact on those people who need to improve their nutrition. We would welcome that with open arms.
Great. Can you talk about nutrition and the immunocompromised? How can someone currently undergoing chemotherapy eat well?
A healthy diet is important for everybody, even people that have adverse health issues right now. Eating a healthy diet, the one that I outlined, is really important for people even those people who have already contracted a disease. However, I would say that people who have special needs really need to talk to a dietitian or a nutritionist to get the advice that might be really tailor-made to their condition. So I would advise whoever wrote that question to seek professional advice.
We hear a lot about diet fads these days, and I'm wondering if you have any special advice for vegetarians or people who are on special diets, and what are your thoughts about intermittent fasting?
Well, if you're a vegetarian, you can eat a healthy diet and live happily ever after, because vegetarians who know what they're doing really do a good job. The problem with being a vegetarian in our society is that many people don't know that they have to find a source of vitamin B12 and omega-3 fatty acids and other essential nutrients. So it takes a little bit of digging and study, and this can be found on good websites. And so I advise people who are vegetarian or vegans to look up the ways in which they can eat healthy diets. Now, I want to say something about fad diets. Fad diets can help you lose weight, and that people have the mistaken notion that losing weight is necessarily healthy. Losing weight can be healthy, but losing weight is not a sign that you're healthy necessarily. And people on fad diets that do that just to lose weight are making a big mistake. Eating a wholesome diet, as I described, is a much healthier way to live, and people who eat that kind of diet usually naturally lose weight in excess pounds anyway. And one other point, women who eat really low-carb diets during pregnancy, it's well demonstrated with scientific evidence that changes the epigenetics of their children and makes them likely to become obese after birth. So we really ask people to stay away from fad diets that are really low-carb, high-fat, high-protein diets, because they do harm to the baby.
Thank you. We have a viewer who is interested in the nutrition boxes going to schools. What is the approach you are using to get the boxes distributed, and what is the cost per box?
Yeah, as I mentioned, each box costs $500, and we're starting to hand out these in our hubs, because the people in our hubs are already connected with the schools, they know about it, and they've had a chance to test these boxes with the children to see what they like or they didn't like. And so now we've got this perfected and we're excited about getting them out. We are going to work with the hubs and all the counties that are next to these hubs, because the word is spreading now that these are available, and we would like to be able to get them to as many schools as possible.
This question makes me laugh, but if legumes are so good, why do they cause so much gas and bloating?
Yeah, that's a really fair question. Some people can't eat them at all because of gas and bloating, and it's really irritating. Unfortunately, that's the effect that they cause, and for some people, they don't notice it at all. But for people who have the problem, they need to avoid eating a lot of legumes. The truth is, though, you can eat a few, you still get the protein and healthy minerals from that, and you can balance it with other vegetables instead.
Great. Is there an explanation about people who have diabetes despite the fact that they exercise regularly and eat really healthy?
Yes, some people have a genetic propensity to having diabetes, and we do see that. But type 2 diabetes can occur because of epigenetic effects that go back a generation or two, even though the genes that ordinarily regulate your metabolism are perfectly normal. So unless we knew the case and the person's history, we couldn't tell them whether it's likely that they have a genetic, that is, a change in the gene sequence that they got from their parents, or whether it's epigenetic because of modification of those genes that occurred as they were growing up. So we offer sympathy for people who suffer this, even though they've done everything right.
How much salt should be included, or I suppose not included, in a healthy diet?
Well, the American Heart Association recommends that you keep your salt load down to less than 2 grams per day. Americans eat 2 to 3 times that usually now. And there are some foods that you can buy on the market that are processed, including soups especially, that have really high, you can get your whole daily load in one bowl of soup. So it's better to use salt sparingly so that it makes your food taste good without using too much.
What more can be done to educate consumers on healthy food choices at the point of purchase? Voluntary grading standards for food, reading food labels is complicated.
This is a real dilemma, and we've been wrestling with this problem for a long time, and I would like to converse with the person who asked the question, because we don't have very good answers for this. We need to change the way people look at food and when they go to buy food, they need to buy most of their foods in the fresh vegetables section. And fruits and vegetables and legumes and the foods that I mentioned are the ones that will keep people healthy. And we don't have a good way to help people understand that. By the way, some people ask me, do I eat processed food? Well, the answer is yes, I do. I drink milk that's been homogenized and pasteurized. That's processed. But the nutritional value of that milk has not been altered by that process. So my view is that there are some processed foods. I'm not just saying don't eat anything that's got a label on it, but be careful about what you eat. And those foods that have a lot of ingredients, and especially a lot of preservatives, don't improve your health at all. And you would be better eating something from the fresh aisle.
Great. What is the best diet to combat any type of inflammation?
Well, that's an interesting question. If you look on the web and you want to search for a search term, you can look up pro-inflammatory diet or anti-inflammatory diet, and you'll find that these have been well worked out. The diet that I recommended to you is mostly an anti-inflammatory diet, and diets with high sugar, high saturated fats are highly inflammatory, and those cause a general state of inflammation in the body that you might not even notice, but nevertheless, it causes epigenetic changes and is likely to damage your body in certain ways. So that's a really good question, and by the way, there's even an anti-inflammatory survey which you have to pay for to take, but you can find out whether or not your diet is anti-inflammatory or not.
I think I've read that turmeric is good for inflammation. Is that true?
That is true. Turmeric has been shown in several studies, even in studies that are preventive of cancers, and turmeric is really a good thing to add to your diet to some degree.
Well, that's good to hear. I love my curries.
Yeah.
Intermittent fasting is gaining popularity. Is there a worry that timed eating hurts epigenetics?
We're not really sure about what episodic fasting does to epigenetics. It's not been studied. Most people say that if you do intermittent fasting and it's not severe, that it's likely not to be harmful. I don't do it myself, but I do think that reducing calorie load is probably just as important, even though I do have friends that do fasting and think that it makes them feel better. So the word's not out, though. I can't give you any scientific evidence that there's value in it from an epigenetic point of view.
It's good to keep in mind. Thank you again, Dr. Thornburg, for joining us today at a safe distance, of course, and for sharing with our viewers information about your important work and its impact on the future. Please note today's presentation will be recorded and available for your viewing on the OHSU Foundation website, and we will email a link once it is available. Before we close, I invite you to please share your feedback on today's presentation. In the chat box, you will see a link to our quick feedback survey, and we would greatly appreciate you taking a couple of minutes to fill that out. Additionally, if you would like more information about Dr. Thornburg's work or any of the groundbreaking research happening at OHSU, please share your name and your contact information in the survey, and a member of our team will follow up with you. This concludes our webinar. Thank you for participating. Have a wonderful day. Stay safe, stay healthy, and don't forget to eat your vegetables.
Thank you, Chelsea.